The government has announced $20 billion is needed to upgrade our hospital infrastructure, which is on average 47 years old and crumbling. Health Minister Simeon Brown has indicated small sums will be spent across the whole infrastructure to get everything up to scratch. But one leading health advocate says it's the equivalent of using a sticking plaster when the patient needs major surgery. Adam Hollingworth reports.
It's being touted as New Zealand's first ever health infrastructure plan. And boy, do our ageing hospitals need it.
We know that New Zealand has health infrastructure which is under significant pressure from ageing infrastructure, which hasn't kept pace with a growing population.
There are more than 1,200 buildings across 86 campuses with an average age of 47 years. Most need major remedial work, earthquake proofing and updating for modern models of care. At the same time, a growing and ageing population means this hospital building in South Auckland is needed.
You've got 12 new operating theatres being built here at the Manukau Health Park. You've also got refurbishment of the existing premise underway. That's an example of what's going to be needed across the country, reusing what we've got, whilst also building the new capacity needed for a growing and ageing population.
It's a long-term plan and the government's looking for funding everywhere, including public-private partnerships.
We've clearly outlined what's required. It's based on a clinical needs assessment as to what's required across the country. And ultimately we will engage with the market to deliver what is needed for New Zealanders.
Instead of building single large-scale structures, the plan proposes a staged approach, delivering smaller, more manageable facilities in phases.
It allows for more staged types of developments, so rather than necessarily rebuilding entire hospitals all at once, it could be new, replacing the acute services building and then replacing the inpatient wards, but it's doing that in a staged way so the market can cope with that.
Labour argues it's time for the government to borrow long term and spend quickly to get the infrastructure built sooner rather than later.
We know that we've got to invest in our hospitals, but it's all talk from the government at this point. I think we want to see some action. So far all they've done is slow down action to rebuild our hospitals, when actually we should be looking at how we can speed that up.
The government says its staged approach will deliver improvements more quickly. But patient advocate Malcolm Mulholland says a bold approach is what's needed, especially when patients are being treated in corridors.
It is my belief that this is just a sticky plaster over a patient that needs major surgery. And I think in time, that unless we invest properly right now, we're going to be paying for more.
Is this staged, smaller patch-up job approach you're taking going to future-proof the health system, or does it push the population growth problems down the line?
Well, I reject the premise of your question. This is a staged development for hospitals across the country. It is the first time we've had a long-term plan for hospital investment in New Zealand.
The plan allows for a 4-stage rebuilding project across the country, but there's a warning. Stage 4 may not be completed within 10 years.